Doctors have noticed that millennials have twice the risk of colon cancer and 4 times the risk of rectal cancer as compared to baby boomers. Joining us this morning to explain what this all means, Dr. Chaffoo, good morning. Always good to see you.
Good morning, Shally. Good to see you.
Millennials with colon cancer? This is so young.
It is, Shally. You know, it's unfortunate that we're seeing an increase, as you said in the opening, of cancers, colon rectal cancers, which we traditionally have thought of as, you know, in people that are older than the age of 50. However, research that's come out from the National Cancer Institute and the American Cancer Society have shown an alarming increase of these cancers in younger people, people under the age of 50, which we would not necessarily expect.
Why are we seeing this?
Well, researchers are not quite clear the cause. We don't really think, Shally, it's genetic, because that would take many generations to show up. We think it could potentially, you know, it could be environmental, could be diet, could be obesity. So there could be a number of factors. We know that risk factors associated with colorectal cancer, Shally, one thing is diet. So if you have a diet that's very high in fiber, that's a good sign. But what we're seeing in people, younger people, there's a higher incidence of obesity. You know, with that obesity is associated a sedentary lifestyle and a change in our eating habits, eating more processed foods. So researchers are theorizing that it could be actual dietary changes that may make this more of a common disease than we would have thought in a younger person.
Yeah, that would make sense. I mean, because they're so young, it has to be something that maybe that they're eating. What is the normal screening age, Dr. Chaffoo, right now?
So right now, Shally, the normal screening age is 50. So 50 and above, you need to have a colonoscopy performed. And so, you know, the question is, are we going to change those factors? And again, we don't know. The researchers are still looking at whether or not we should look at starting screening at a younger age. There are some home kits that you can take and use. However, that's more noticeable if you've already got a colon cancer. But the big thing, you know, is public awareness for people to understand that, you know, colon cancer is more prevalent than we thought it was in the younger age group. And the other really important thing is, what are the, you know, 4 major warning signs or symptoms of cancer of the colon or rectum? I mean,
what are those?
So the 4 things are, number 1, a change in bowel habits. So perhaps going from having regular bowel movements to more constipation. Occasionally it can be diarrhea, or even a change in the caliper or the size of the stool getting smaller. Abdominal discomfort, gas or cramps that persists, that doesn't go away, and then bleeding from the rectum, and then finally fatigue or weakness. So those 4 symptoms, Shally, you know, in someone my age, you know, first thing I want to do is go see the doctor. But in the millennials, somebody in their 20s, are thinking, well, it's nothing to really worry about. But in fact, it is something to be concerned about.
Okay, I want to talk on about a different study that we've been talking here on the morning show today. Doctors saying not exercising is as bad as being obese. What does this mean?
Well, it's fascinating. There was a study that came out of Rotterdam. They looked at about 5,000 plus people that were average age of 70, and they followed them over a 15-year period. And they found that people, Shally, that actually were overweight, we know is associated with a higher incidence of heart disease. But in that subgroup of people that were overweight that also exercised, their risk for heart disease seemed to be much closer to people that were of normal weight. And so what that signifies is, at least, and again, it's a small one study, seems to indicate that exercise does have a protective effect. Now, the truth is you can't outrun a bad diet. We know that obviously obesity is associated with other significant problems, especially with diabetes, and there actually are 11 cancers, not just colon cancer, that's associated with obesity, but we cannot underestimate the importance of exercise overall in one's health and longevity.
And then I know that there's been a lot of studies too that too much exercise can also not be the healthiest option as well, right?
That's a great point, because, you know, as we age, our musculoskeletal system isn't what it was in a 20-year-old. And so if you're out doing very, very strenuous exercise activities, as we get older, we lose some of the cartilage. You know, orthopedic surgeons will tell us, so you get more bone on bone, and in those weight-bearing joints, the spine, the hip, the knee, you're putting a lot of excess weight, and there's more wear and tear, more likely to have injuries. So too much exercise, in a sense, is almost as bad as no exercise at all. So it's moderation.
Everything in moderation. Dr. Chaffoo, always good to see you.
Good to see you, Shally.
7:46.